Good day! Today, we're going to discuss the topic about First Aid Basic. First aid. It is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. It includes either emergency measures for life-threatening conditions which require further medical attention, or care for less serious injuries which may be adequately treated on the spot. As an urgent care given to an injured or unexpectedly ill person, first aid also involves home care and self-care if medical assistance is delayed or not available. First aid should be used anytime there is an illness, injury, or emergency situation that requires treatment when the emergency personnel have not arrived. First aid refers to the emergency or immediate care you should provide when a person is injured or ill until medical treatment is available. For minor conditions, first aid care may be enough. For serious problems, first aid care should be continued until more advanced care becomes available. Here are some words that we always think when we hear the word first aid. First aider, accident, injury, emergency, first aid kit, and bystanders. First aider. Their role is to provide immediate, temporary care to someone who is ill or injured. They are the one who deals with the whole situation involving the patient and the injury or illness. The PNRC, or the Philippine National Red Cross, conducts training for people who like to become first aider. As a first aider, you must be gentle, resourceful, observant, tactful, sympathetic, consoling, and respectful. You should maximize the use of materials at hand, know how to improvise and how to assess the situation and the victim properly, and exhibit professionalism. You must not cause further harm by making the victim panic. Accident and injury. Accident is an unexpected event with negative consequences, occurring without the intention of the one suffering the consequence, while injury is damage to the body of a human or animal. Emergency. It is a sudden, urgent, usually unexpected occurrence or occasion requiring immediate action. First aid kit. It is a collection of supplies and equipment that is used to give medical treatment. A basic first aid kit may contain the following: plasters in a variety of different sizes and shapes, small, medium, and large sterile gauze dressings, at least 2 sterile eye dressings, triangular bandages, crepe-rolled bandages, safety pins, disposable sterile gloves, tweezers, scissors, alcohol-free cleansing wipes, sticky tape, thermometer, preferably digital, skin rash cream such as hydrocortisone or calendula, cream or spray to relieve insect bites and stings, antiseptic cream, painkillers, antihistamine cream or tablets, distilled water or cleansing wounds, eye wash and eye bath. You need to also include the user guide of first aid. Bystander. According to Merriam-Webster Dictionary, they are the one who is present but not taking part in a situation or event. We must learn the first aid method of DRSABCD, that stands for danger, response, send for help, airway, breathing, CPR or cardiopulmonary resuscitation, and defibrillator. Danger. Always check the danger to you, any bystanders, and then the injured or ill person. Make sure you do not put yourself in danger when going to the assistance of another person. Response. Is the person conscious? Do they respond when you talk to them, touch their hands, or squeeze their shoulder? Send for help. Call emergency hotlines. Don't forget to answer the questions asked by the operator. Airway. Is the person's airway clear? Is the person's breathing? Note, if the person is responding, they are conscious and the airway is clear. If the person is not responding and they are unconscious, you need to check their airway by opening their mouth and having a look inside. Breathing. Check for breathing by looking for chest movements up and down. Try to listen by putting your hand on the lower part of their chest. CPR or cardiopulmonary resuscitation. Here is the demo on how to do it.
You arrive on the scene. Check the scene for safety. Check the victim for consciousness. Gently tap their shoulder and shout.
Are you okay? Are you okay?
If no response, call 911 immediately.
You, call 911.
If the adult is lying on their stomach, turn them over and to their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the adult's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the adult's chest and compress the chest 2 inches in depth, 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make their chest rise. Continue with 30 compressions and 2 breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you see signs of life, another rescuer takes over, or help arrives.
Defibrillator. Here is the demo on how to perform it.
Automated external defibrillators, or AEDs, are in lots of public places these days, like airports, shopping centres and sporting clubs. They're really easy to use and they can save a life. So we're going to give you a quick demonstration of how to use them right now.
Public access AEDs are usually found in readily accessible places, clearly marked by a sign. They could be stored in a rack like this one or in a cabinet. If you're in a public facility like a shopping centre or sports club and you don't know where the nearest AED is, ask the staff for help.
So if you find someone collapsed and unresponsive, call 000 and look for your nearest AED.
Open the AED and turn it on. These devices give you audible step-by-step instructions, so they are really easy to use.
Plug in pads connector. Attach pads to bare skin exactly as shown.
Remove any clothing to expose the patient's chest area. You may need to cut the clothes, and some AEDs include scissors for this purpose. If the patient has a hairy chest, you may need to shave the spots where the pads are to be placed, as they need to make good contact with bare skin to work properly. Place the pads like this. One goes on the upper right side of the chest, just above the nipple, while the other is positioned on the left side of the patient, in the lower rib area. Most AEDs have clear instructions on where the pads need to go. When you've applied the pads, the AED will analyse the patient's heart and decide if a shock needs to be delivered to return the heart to a normal rhythm.
Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm.
Some AEDs will ask you to press a button to deliver this shock, while others will do it automatically.
Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered.
The AED will tell you when a shock has been delivered, and it's really important to begin CPR straight after this. To do CPR, place the ball of one hand on the centre of the chest and place the other hand on top, interlocking the fingers. Push hard and fast straight down at a rate of between 100 and 120 per minute. Keep doing this until the AED tells you it's reanalysing the heart. This will happen roughly every 2 minutes. Continue CPR and keep listening to the AED instructions until the paramedics take over.
Before we end this discussion, let me give you these quotes. Be a hero. Save lives. First aid is for everyone, everywhere. Accidents do happen. Make first aid as your best mate. Thank you for listening. I hope you gain some knowledge. Always take care.